So there's a disastrous new report that shows how much we waste due to our inefficient, wasteful, overcomplicated healthcare system. So this is according to a new analysis published in JAMA. The U.S. apparently wastes nearly $1 trillion when it comes to healthcare. So now the numbers range from about $760 billion to about $935 billion annually, or about 25% of the nation's total healthcare spending. So now 25% might not seem like a lot, but we spend, and this will blow your mind, about $3.8 trillion on healthcare as a country annually. This is more than any other country in the world, by the way, twice as much as they do in the UK, twice as much as in Canada, and we waste about $1 trillion of it. That's insane. Now, this is according to Dr. William Schrank, the chief medical officer at the health insurer Humana, and his colleagues. So now they looked at this, and his colleagues include Teresa Rogstad from Humana, Dr. Natasha Parikh from the University of Pittsburgh School of Medicine, etc. And they basically looked at 6 wasteful domains identified by the Institute of Medicine report authors. And the estimated costs, they say, of waste and potential savings from interventions that address waste are as high as 760 billion, 930 billion, and 191 billion to 282 billion, respectively. So just the cost of trying to intervene and get potential savings from that still costs 191 to 282 billion dollars a year. Jesus. So now, what were the main problems that they identified? Well, there were failure of care delivery, failure of care coordination, overtreatment or low value care, pricing failure, I can see a lot of that, fraud and abuse, and administrative complexity. So all of those factors contribute to the near $1 trillion a year worth of waste in our healthcare system. So now, overall, the takeaway from their analysis is this. The U.S. healthcare system, they say, is layered with complexity, lacks transparency, and lacks coordination between medical care providers and those entities that pay them, those entities being, of course, for-profit health insurance companies. So, now, I love how they bring up transparency. We don't have any. For example, why is it that a bag of saline can cost anywhere from near $500 to $700 per patient? Who makes that decision? I mean, who marks that up? Again, a saline takes about $1.07 to manufacture, right? They mark it up to $500 to $700 for a bag. There's no transparency in pricing. There's no transparency in pricing when it comes to drug manufacturing as well. A complete and utter disaster. So now, there's the coordination, of course. There's a problem as well, because there are so many different insurance companies, so many different plans, different rates in network, out of network, different doctors, coverage levels, co-payment levels, deductibles. It's incredibly insane. Extremely complicated. So doing that coordination between hospital, payer, etc., or payee is just, it's massive. It's massively complicated unnecessarily. And so that's a part of a lot of that waste. You waste a lot of time trying to figure out who to bill, what to bill them for, and getting them to pay, et cetera, et cetera, et cetera, right? In fact, administrative complexity was found to be the greatest source of waste in the United States. So that's interesting. Even with all those other factors, turns out that you have too much administration, too much complexity within the administrative portion of actually delivering healthcare, whether it be the administration of health insurance companies as well as hospitals. Too much bureaucracy, too many layers. So now how do you get rid of that? How do you simplify things so you can bring down costs and eliminate this kind of waste? Single payer healthcare, Medicare for all system. You eliminate the middleman, eliminate the insurance companies, and that's the only way a single payer system will actually work. is if you eliminate all the other payers. You just have the government who collects tax money and then pays the hospitals and then negotiates directly with the hospitals on what, and how much they're actually willing to pay. With a multi-payer system, even if you have a public option, and a public option won't work because of this reason, you can have a public option that does not have enough negotiating power to really effectively change prices. These private insurance companies will continue to pay the same prices to the hospitals and continue to pass on the premium to you, and then, of course, pocket the difference. And so they'll also use that money that they get in profit to be able to weaken any sort of public option legislation, reduce the amount that it covers, and essentially create what is a death spiral system, where only the oldest, weakest, and sickest people go to the government plan, and the healthiest people and the ones that will bring them the most profit margin will go to private insurance, which of course will end up being a little bit cheaper under that specific system. So that's one of the problems with your public option plans versus a Medicare for all single payer system. And it definitely relates to a lot of this waste and administrative bloat, essentially what you have. Medicare, again, has a very small operating cost, administrative cost. They actually have a less administrative cost than a lot of for-profit private insurers. They also don't have advertising fees, and they don't have all these other superfluous costs that basically put money into the pockets of shareholders. They don't have to worry about that. All they have to worry about is taking the correct amount of tax money, negotiating prices directly with hospitals, and then paying that. That actually simplifies everything, and that's why you have reduced prices. And so that's why private insurance has to go. It's incredibly inefficient. Now, there's one more point here that I think is interesting to bring up, and that's our current spending on healthcare. Now, I know Republicans and corporate Democrats are both saying, oh my God, Medicare for all, we can't do that because it's going to cost $32 trillion over the next 10 years. That's $3.2 trillion a year. You know how much we pay right now? Well, I mentioned it before. About $3.8 trillion. And nearly $1 trillion of it is complete waste. Whereas $3.2 trillion, and that's a rough estimate from different studies and even conservative studies have said that we save that much. Even with that, you cover everyone with less than what we pay now. With the money that we basically waste in our healthcare system, we could cover everyone and cover more. Again, Medicare for all, the current bill that's in Congress covers dental, vision, hearing, maternity, all these different things. It's a massive expansion of the benefits of Medicare because under that system, everything is covered, so you don't need to go to a private insurer. And we can still do it less than what we do it now. And so that's absolute insanity. $900 billion in waste. Current system, Medicare for all, would eliminate most, if not all of that waste and overhead bloat. Everyone's covered, and they end up having actually better coverage. It would be the equivalent of a Cadillac plan, according to John Delaney. And John Delaney is not in favor of Medicare for all. But even he had to admit, Medicare for all, it'd be equivalent to a Cadillac plan. So that's why we can't have it, even though it costs less, covers more, and is actually superior healthcare. Hey guys, hopefully you enjoyed that free video. Now I'm going to have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a Patreon, patreon.com/TYTNation, set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, You know the show. You know how I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent progressive media.